everyone, my name is Dr. Nabila Noor and I'm a board-certified urogynecologist and a pelvic health specialist. I take care of women with pelvic floor issues, such as urinary leakage, which could be because of laughing, coughing, sneezing, exercise, or there's some women who have leakage because they cannot make it to the bathroom. They always feel like they have to go, they cannot hold it. Nighttime urination. Sometimes some of these patients have what we call fecal incontinence, where they're not able to control their bowel. There's also something called pelvic organ prolapse, where you have your pelvic organs, which could be the uterus, the bladder, or the rectum, kind of trying to push through your vaginal opening. Recurrent UTIs, so urinary tract infections, pelvic pain, women suffering from issues of menopause and having pain with intercourse. Those are some of the conditions that your gynecologist treats and talks about. What always disappoints me is that, whenever I'm seeing patients in clinic, I cannot tell you how many times the first thing patients tell me is that it took me so long to find somebody like you. When you are suffering from these conditions, please talk to your primary care doctor. Talk to your OBGYN and ask them if they can refer you to a specialist. Why is it important to see a urogynecologist or a specialist when you have these conditions? The reason it's important is because as a subspecialist, I have gone through additional training to be taking care of patients suffering with exactly these problems. And I think sometimes patients have the misconception that since I'm a surgeon, when they come to see me, I'm only going to offer them surgery. And that is far from the truth. There are so many amazing non-surgical treatment options. So when you first come see me, we're going to talk about what are some of the things that's bothering you, what brought you here, and what are some of the treatment options. Together, let's learn about these conditions. Let's try to remove the stigma from talking about these conditions, because a lot of the times women are told that, it's just a part of aging, you should just live with it. Well, yes, age is a risk factor, but there does not mean it's normal, and definitely not something that you should be okay living with. There are amazing treatment options, and if nothing, let's actually learn about these options. Let's educate ourselves so that we can decide what's important for us.